Good morning. Welcome to the Senate Committee on Commerce and Labor. Madam Secretary, please call the roll.
Senator Daley. Here. Senator Ellison. Senator Flores. Senator Lang. Here. Senator Rogish. Here. Senator Scheibel. Senator Steinbeck. Here. Chair Pezzina.
Present. Please mark Senator Scheibel absent excused, and please mark Senators Ellison and Flores present when they arrive. Welcome to our audience this morning in Carson City, in Las Vegas. I'm not sure if there's anyone there, and on the phone lines. Before we begin, I'd like to make several housekeeping announcements. I'd like to remind everyone to please silence all of your electronic devices while in the committee room. Members of the public may provide testimony in various ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in the place of testifying. And if you do wish to testify in person, please sign in at the table by the door and leave your business card with our wonderful committee secretary. When testifying in person, please turn the microphones on to speak and off to listen, as we may have others listening and viewing in online, and it looks like probably not in Vegas today. Please also state and spell your name for the record. Anyone who'd like to receive electronic notifications of scheduled bills and access to the committee's meeting materials may do so by signing up on Nellis on the legislative website. Committee members will be using their laptops to view handouts and other exhibits. Please do not view this as a sign of disrespect or inattention. With that, we are going to move to our very first agenda item of the day, and that will be Senate Bill 231, establishing provisions relating to the collection and destruction of unused drugs. Welcome up, and we will get started when you're ready. Thank you.
Well, thank you, Chair Pezzina and members of the committee. I'm Jeff Stone, and I represent Senate District 20 from Mesquite, including Henderson, all the way to southerly to Laughlin. It's my pleasure to present SB 231, which proposes to establish provisions relating to the collection and destruction of unused drugs. The appropriate and the legal disposal of expired or unused prescription drugs is important to prevent drug diversion, protect our landfills, and safeguard our finite water supplies. Diversion. Many citizens often store their used or expired pharmaceuticals in their medicine cabinets in their bathrooms or in their cupboards. This leaves their drugs vulnerable for children, grandchildren, or even strangers visiting them to take them, ingest them, or if a controlled substance, actually sell them on the street. In our rapidly aging population, which I am now a member of, there is a higher propensity of being prescribed a controlled substance for pain control, not limited to, but including hydrocodone, which is the generic name for Vicodin, oxycodone, the generic name for OxyContin, hydromorphone, the generic name for Dilaudid, or just plain morphine, or a controlled anti-anxiety drug, which is a common one is Xanax, or a sedative hypnotic such as Halcion or Triazolam. These drugs can be potentially legally sold on the streets and sold for a lot of money. Data from law enforcement agencies has shown that OxyContin tablets can be sold for $50 to $80 a tablet. OxyContin generics for $12 to $40 a tablet. Hydrocodone or Vicodin $5 to $20 a tablet, and Xanax as much as $20 a tablet. Because of the inconvenience of finding a drug disposal box nearby, many people just throw their pills in the rubbish, polluting our landfills, or often flush their pharmaceuticals down the toilet, forever tainting our water supplies. You see, many drugs that are water soluble cannot be filtered out by water treatment plants. Hence, these drugs tend to accumulate in our water supplies over time, especially in southern Nevada, where we have a robust toilet-to-tap program that's so essential in confronting our water scarcity and low water levels of Lake Mead. But we also see an increasing level of trace drugs, which may present health issues in time. As an example, studies have shown traces of drugs that are excreted by the body or those that are improperly disposed of find their way to Lake Mead, a major source of drinking water in southern Nevada. Some of these drugs that are found in our water supplies have actually been implicated in potentially causing cancer. So what is the solution? Installing more drug disposal bins in retail pharmacies throughout Nevada. The DEA has promulgated the Code of Federal Regulations Title 21 that allows for the installation of drug disposal bins, and through this regulation ensures that bins are placed in pharmacies where they can be observed while the pharmacy is open and closed off and locked shut. when the pharmacy is closed. Also allows for reverse distributor licenses by the DEA to pick up the discarded pharmaceuticals and destroy them, usually by incineration in accordance with Title 21, which is fully traceable and accountable. One national disposal company has recently reported that over 1 billion pounds of pharmaceuticals were destroyed in just 1 year. The issue is that there's not enough of these drug disposal bins in Nevada to appropriately discard pharmaceuticals. The Nevada State Board of Pharmacy in 2023 has identified the number of existing drug disposal bins in pharmacies in Nevada from a shared database that they have with the DEA. In Elko, there are 3 pharmacy locations. In Reno Sparks, 11. Las Vegas Henderson, 28 locations. That's a total of 42 pharmacies for 3.2 million people, or 1 bin for every 76,190 people. There are also some drug disposal bins at certain police departments and sheriff's departments throughout the state, which are not included in my count. For comparison, California has a similar program. Sacramento, California alone, approximately 520,000 people within a 20-mile radius, has 96 pharmacy locations, or 1 for every 5,426 people. So what would this bill do? It's going to encourage, it's not going to mandate, that pharmacies, especially chain stores within their market share, consider adding more drug disposal bins statewide, making the service better advertised and available, and expand to more convenient locations for patrons to utilize. So why would a pharmacy even consider putting these drug bins in their pharmacies throughout Nevada? Well, of course, providing this eco-friendly and public safety service can be advertised as a wonderful community partner, and one could also predict that these bins would increase traffic of customers in their stores to buy more drugs and sundries as they come in to discard their drugs. Pharmacies that install these bins cannot, by this legislation, charge a fee that uses the bins to discard their pharmaceuticals. It's a 100% free service offered by the pharmacies that are participating. Pharmacies participating need to get regulatory approval from the United States Drug Enforcement Agency. The DEA remains the lead regulatory agency overseeing this program. The Nevada State Board of Pharmacy does not require or mandate or desire to mandate permission via an application or permit for the same, as opposed to some states in California that do, which raises the cost for the pharmacies. There are also no legal requirements for a participating pharmacy to notify local law enforcement agencies in the municipality where the bins are located, nor is it necessary, as the DEA is the chief law enforcement agency for the program. Examining the bill more specifically, Section 1, Chapter 639 of NRS is amended to add a new section. 1. A collector that maintains a secure drug take-back bin for the collection and destruction of home-generated pharmaceuticals shall comply with all applicable state and federal laws and regulations relating to the collection of home-generated pharmaceutical waste for destruction in secure drug take-back bins. Ensure that the take-back bins is placed in a location that is regularly monitored by employees of the collector. Ensure that conspicuous signage is posted on the take-back bins, clearly notifying the customers that, 1, the substances are not acceptable into the bin, such as Schedule I drugs, or syringes or needles, and 2, the hours during which the deposits into the bins are permitted. D, ensures public access to the bins is limited to the hours in which the employees or the collectors are present and able to monitor the operation of the bin. E, regularly inspects the bin and surrounding areas for potential tampering or diversion. F, maintaining a record of inspections that must be documented in writing or electronically, including the date and time of each inspection and including the initials of the employee who conducted the inspection. And G, retain each record related to the secure take-back bins required by the state and federal laws for at least a period of 2 years. H, notify at least one law enforcement agency of any suspected or known tampering or theft or significant loss of controlled substances that occurs no later than 1 business day after the date on which the tampering, theft, or significant loss is suspected or discovered. A collector cannot receive compensation from a customer of the collector to maintain the secure drug take-back bin. Any collector that maintains a secure drug take-back bin and complies with subsections 1 and 2 is not subject to any disciplinary action by the board of pharmacy for any injury or harm that results from the collector maintaining a secure drug take-back bin on its premises, unless the injury results from the gross negligence or willful and wanton misconduct of the collector. There is no mandate for the pharmacy to install and maintain such a bin. Again, the program is purely voluntary. The Board of Pharmacy may adopt regulations for take-back bins if they feel it's prudent. In number 6, number of definitions defines collector authorized by and registered with the DEA to receive a controlled substance for the purpose of destruction. 6A2, that is in good standing with any licensing authority, that being the collector, defines home-generated waste, defines law enforcement, defines maintained, defines pharmaceutical, defines secure drug take-back bin, defines solid waste management system. In Section 2, this program is funded by a $500,000 grant from the Fund for Resilient Nevada created by NRS 433.732 of the Division of Public and Behavioral Health and the Department of Health and Human Services. Section 3, the act, if passed, becomes effective on July the 1st, 2025. So in summary, colleagues, Nevada has a shortage of drug disposal bins. This is a voluntary program. It is not a mandate. The service is free to any citizen to responsibly discover their pharmaceuticals responsibly and safely. This will reduce illicit drug diversion. This will stop depositing these potentially toxic drugs into our landfills and our water supplies. Thank you, Chair Pazina and members of the committee, and I'm available to answer any questions that you might have.
Thank you, Senator Stone. And I remember this very well from last year, last session, as Senate Bill 183. And we welcome you back today. Also, thank you, as you found out at 5 p.m. yesterday, that you would be presenting at 8 a.m. this morning. So we appreciate the very last moment nature of your testimony this morning. Do we have any questions from the committee? For those of you who were in the Senate last session, you probably remember this bill well. We voted on it last session, but for those of you who are new to the committee, you might not have looked at Senate Bill 183 from the 2023 session. So are there any questions this morning? Senator Ellison.
And I apologize. Is this only going to be in pharmacies, or is it going to be in places that there's other problems? Like I know that they found a lot of needles and stuff in libraries and the bathrooms and stuff. Are they going to be able to utilize this also? I think it's a great program and anything to get this kind of stuff off the streets, but is that something that...
Thank you, Senator Edelson, for the question. Senator Jeff Stone, for the record. Right now, there are some disposal bins that are in sheriff's facilities or police stations for people to dispose of them. I'm not aware if there are any libraries, but this bill is specific to pharmacies only.
All right, Senator Steinbeck and then Senator Lang.
Thank you, Madam Chair. Thank you for the presentation, Senator. Quick question, is the Schedule 1s being not included in this? Can you just expand on that reason?
Yes, because in accordance with the federal government, these are illegal drugs, and so it was recommended that we exclude Schedule I drugs so that we don't have people bringing in what would be considered federally illegal into a legitimate pharmacy and the liability associated with that. And the bins are not structured in a way that where they can accept needles, and so we'll need a separate type of a facility or infrastructure to accommodate needles that need to be disposed of.
Thank you. I just would be a better place for them to be disposed of course, than the waterways and other
even though we
areas.
say that you can't, excuse me for interrupting you, Senator Jeff Stone, for the record, even though it says you cannot dispose of any Schedule I drugs, I can assure you that in California, where this was passed, many Schedule I drugs were successfully deposited into these depositories and incinerated.
Well, thank you.
Mm-hmm.
Senator, thank you for bringing this bill back. I'm really dismayed in my district. I have looked all around for depository places and can't find any. So could you tell me what your plan is to get these bins in drugstores or different facilities so that they are more, because really I notice in different parts of town, there are more, right? And so like on the west side of Las Vegas, there seems to be more bins than on the east side of Las Vegas. How will we get these bins and how will we advertise maybe to get them into facilities?
Thank you, Senator Lang, for the question, Senator Jeff Stone. The State Board of Pharmacy and the DEA have on their website the location of the bins. And I'm hoping with the passage of this bill that will make it easier and less expensive, if you will, because now we're funding the cost of putting the bins in and for the incineration, that more pharmacies are going to participate, and obviously pharmacies are going to, especially chain stores, are going to strategically place those, so it is more convenient for people to utilize them. So, you bet.
All right, Vice Chair Daley.
Thank you, Madam Chair, and also thank you for bringing this back. I do recall from last session the bill. And just refresh my memory a little bit. I know, if I recall correctly, there's all the tamper-proof measures so people can't steal it, but then I also understand, if I remember correctly, you don't really monitor the cameras in the area because you want people to utilize them and not feel that they're being monitored and all that stuff. That's all still in the place, and that's all regulated or whatever by the DEA when they get permission to have these. And then I think we asked the question last time is, you say no Schedule I jugs, but nobody looks to see what gets put in there.
That's right.
And there's no really way to regulate that other than say you'll have a notice that says you're not supposed to. And if I remember, just confirming, once that is collected, it's collected under the provisions under the DEA rules,
Correct.
And then it's incinerated. That's correct? Just wanted to confirm that. I refresh my memory a little bit on those points of this collection process.
Yes, thank you, Senator Daley, for the question, and you're right in everything that you just said, including that the bin has to be right with where the pharmacy is. It has to be where it can be observed while the pharmacy is open and completely shut down when the pharmacy is shut down. And the DEA license the reverse distributors to come in and to take the medications and give a receipt for what is taken, and that gets reported twice a year to both the State Board and to the DEA.
Senator Rogich.
Good morning, Senator Stone. Thank you for this presentation. I have a quick question with regard to the Schedule I drugs, specifically the cannabis. If someone places cannabis in the bin, do you follow the disposal regulations that the CCB sets out with regard to waste and disposal of cannabis?
I don't, Senator Stone, for the record, thank you for the question, Senator Rogich. The reverse distributors come in and they just empty the bin, and they go and incinerate. They don't inventory what's in the bin. So I would presume that probably not.
All right. Seeing no further questions, we thank you so much for your presentation today, Senator, and we'll have you step back from the table, and we will start testimony in support of Senate Bill 231. And we realize there may not be as many in support only because no one knew this was happening until the last moment. So we'll begin testimony in support of Senate Bill 231.
Thank you, Madam Chair. Alex Tanchek with Silver State Government Relations, representing Stericycle. Stericycle is one of the world's largest companies that specializes in the collection and disposal of medical waste, including pharmaceutical wastes. The proper destruction of prescription drugs is a critical safety issue for Nevada's residents and Nevada's environment, and we want to thank Senator Stone for bringing this bill back and the committee for considering it. Thank you.
Thank you so much. All right. We do now have people in the audience in Las Vegas, but no one's coming to the table, so we will move to our phone lines. Broadcast, do we have anyone on the phones in support of Senate Bill 231?
Chair, your public line is open and working, but you have no callers at this time.
Thank you so much. All right, we will move to testimony in opposition of Senate Bill 231. In our physical location, seeing no one, broadcast. Anyone on the phone in opposition of Senate Bill 231?
Chair, you have no callers at this time.
All right, we'll close testimony in opposition and move to neutral. Do we have anyone in neutral on Senate Bill 231? Seeing no one coming to the tables in Carson City or Las Vegas, broadcast. Anyone joining us on the phones in neutral on Senate Bill 231?
Your public line is open and working, but you have no callers at this time.
Okay, thank you so much. Senator, would you like to come back and make any closing statements?
Thank you, Chair Pazina and committee. Just I want to thank you for your consideration of this bill. It's coming back because in the last session there was no funding associated with the bill, and there was afraid that there was going to be an unfunded mandate on pharmacies. But now there is funding available, and hopefully this will help us clean our landfills, keep our water clean, keep diversion under control. And I thank you for your consideration.
All right. Thank you so much, Senator. And with that, we will close the bill hearing on Senate Bill 231. Before we begin our next bill presentation, we are going to introduce a BDR. As you'll recall, the referral deadline for individual bills was this Monday. However, we do still have committee bills being introduced. So as you know, committee, throughout the session, we and other committees are asked to introduce committee bill draft requests to begin the bill process, assign a bill number, and get it referred to a committee. Your vote to introduce a committee BDR is no indication of any support. It's literally just to get the process started. Today, we have BDR 32-952, an act relating to financial institutions, eliminating an excise tax on certain bank branches and providing other matters properly relating thereto. All right. Do I have a motion to introduce BDR 32-952? Thank you. We have a motion from Senator Ellison, a second from Vice Chair Daley. Any discussion before we take a vote? All right. All in favor, please say aye.
Aye.
Any opposed? All right, the motion carries for BDR 32-952. Thank you so much. And with that, we will move to our second bill presentation of the day, which is Senate Bill 268 with Senator Flores, and that revises provisions relating to insurance coverage for certain dental services. So we'll ask Senator Flores and any co-presenters he may have to head up to the table, and we can begin when they're ready. Thank you so much.
Good morning, Madam Chair and esteemed colleagues of the Commerce and Labor Committee. I am State Senator Edgar Flores, proudly representing Senate District 2. I have the honor of having Ms. Chandler joining me this morning, Executive Director of Future Smiles. As you all may have in front of you, this packet, it just provides amazing information about the work that's being done in Nevada. And I'll let her talk a little bit about that in a second. We're also joined by Mr. Hardy, who we've all had the pleasure of working with over the years, who will be providing a section-by-section breakdown of Senate Bill 268. Today, on behalf of my constituents, I am very proud to present Senate Bill 268. Madam Chair, I've always talked about an unfortunate reality that I share with a lot of folks in my constituency, that for so long when we talked about oral hygiene, dental care, it was something that was abstract and we were disconnected from it. I grew up in a very humble home, and we as kids saw dental care, hygiene care as something that was detached from us. It was for the elite, the rich, but not something that you ever went to, and much less something that you ever did unless it was an absolute emergency. I've shared publicly in the past that it's just not something I never had an opportunity as a child to visit a dentist. I did not know what that was like until I was a young adult in college. It was the first time that I really started engaging in that, and mostly because we couldn't afford it. We didn't have insurance, and it's an unfortunate reality that continues to be true today. But fortunately, because of Future Smiles and other individuals and nonprofits who have focused on serving kids like myself when I was a child, we now have programs that are directly working within our school district and serving these children who, unfortunately, like me, believe that this was something that they couldn't afford. So what are we trying to address? I just wanted to make it clear that back in the 2000s, the Nevada Legislature passed a law clarifying that public health dental hygienists may provide certain services without the direct supervision of a dentist. While these services have been provided ever since, some private insurance companies have been denying a claim for payment because the services are provided without the supervision of a dentist that is permitted by the NRS. So there is confusion there. And this is where we insert ourselves in this conversation. If we want to continue to grow programs like Future Smiles, and I will also say that in working with communities and schools and other wraparound services in the state of Nevada, we've had the opportunity to directly work and see the amazing work that is done, particularly in my school district. In my the schools in my district is what I meant to say. It's just amazing work that's being done there. With that, Madam Chair, if I may, I'd like to hand over the presentation to Ms. Chandler, just so that she can tell you a little bit about all the amazing work that's being done and some of the challenges that she's been facing over the years.
I'm Terry Chandler for the record, Terrichandler. Good morning, Senate Committee on Commerce and Labor, Chair Senate Pazina and Vice Chair Daley. Thank you for the opportunity to address the committee today. We very much appreciate Senator Flores and his willingness to help us address a particular barrier to services. On behalf of Future Smiles and myself as a public health dental hygienist, we are in support of SB 268. I'd like to take a moment to introduce you to Future Smiles. We are a Nevada nonprofit with an IRS status of 501c3, governed by a volunteer board of directors. Our nonprofit began operations in 2009 by focusing on school-based dental care for underserved children in Southern Nevada. Future Smiles has an approved program protocol by the Nevada State Board of Dental Examiners that allows our dental hygienists to hold a special endorsement to practice public health dental hygiene without the supervision of a dentist. The program communicates monthly with the Nevada State Dental Board to share what schools or community sites we are going to with our mobile school sealant program. And biannually, the dental hygienists are renewing their license and their special endorsement. And during that time period, they submit that to the dental board with documentation of all the services that we have provided during the 2 years. In NAC 631.200, a dental hygienist may conduct an assessment of oral health of the patients and develop a dental hygiene care plan as set forth in subsections 1A through N. Furthermore, when a dental hygienist is issued the special endorsement, the dental hygiene services are provided through the assessment and implementation of a dental hygiene care plan without the supervision of a dentist. CDT codes are used to describe the dental hygiene services. That's standard throughout the industry of dentistry. These CDT codes include D0190 for an oral health screening, D0601 for caries risk assessment, D1206 for fluoride varnish applications, D1351 dental sealants, D1355 for caries prevention medicaments, and D120 and 110 for prophylaxis, which you all call a dental cleaning. Additionally, in NAC 631.200, there are requirements that the patient be referred to a dentist for follow-up care, diagnostic services, and any services that the dental hygienist is not authorized to perform under statutes. Future Smiles accomplishes this with our case managers who are bilingual. They support our families by navigating the children to a dental home. We also use grant dollars to cover the costs for root canals and oral surgery and other needs that the children have. We also offer Medicaid enrollment from our specialists as well as the welfare office. There's a person that comes from the welfare office that's accomplished in Medicaid enrollment, and they come once a week to our facility. Future Smiles holds a memorandum of agreement with the Clark County School District. In this agreement, there are guidelines for our insurance coverage, which includes general liability, professional liability, and auto liability. Our team's also required to have fingerprinting and background checks by the Clark County School District. And what I failed to mention in some of my letters to you, this program goes into the schools with portable equipment. So we have 2 transport vehicles that we put everything on trolleys, bring everything in bins, go into a classroom, a computer lab, or wherever the school has space for us. So the kids miss about 20 to 30 minutes of classroom time, and mom and dad don't have to take off from work. Our delivery model incorporates 4 pillars: education, prevention, restorative services, and case management. Since inception, our organization has served more than 270,000 children with oral health education and toothbrushing supplies. Many of these low-income children, they don't even have their own toothbrush, they share it. We've seen 54,000 children and have provided preventive and restorative dental care to those children, and more than 151 teeth have received a dental sealant on 32,000 children. CDC research shows that 80% of those sealants will not get a cavity during the first 2 years of placement. So preventing decay, preventing disease is really what the main goal of the program is. Unfortunately, tooth decay is the most chronic childhood disease in the United States. 50% of the children seen by Future Smiles have untreated tooth decay cavities. And 2 out of 10 children are experiencing daily dental pain because of the cavities and the infections. As you can imagine, traveling to school breaks down a multitude of barriers, like parents taking off from work and children missing vital classroom time, and routine dental care is provided regardless of an insurance status, which helps to improve access to dental care. Our families are families of 5 living on less than $2,000 a month. 50% of the children we see are enrolled in Medicaid, and 40% are uninsured, and 10% have a private dental insurance. SB 268 will align NRS 631.287, which is the section for our dental hygiene public health endorsement, and NRS 689A under the Insurance Commissioner, establishing our dental hygienists as direct healthcare providers recognized by all dental plans as the state law provides. Some dental insurance plans, through their guidelines, they have coverage that is limited to only when a dental hygienist is practicing under the supervision of a licensed dentist, but this is in direct conflict with NRS 631.287. Furthermore, when dental plans prohibit reimbursement, it limits the access to care and forces the nonprofit to use vital resources that should be reserved for children who are actually uninsured. I provided the committee with some materials that you all have on your computers, and one of those materials is the 2022 Personal Health Choices Report. In the report, it looks at emergency department data. Did you know that in 2022, 72,162 Nevadans actually utilized our emergency departments for acute dental pain and infections? Of these, nearly 20,000 were children under the age of 18. The average emergency discharge fee is $4,537 and could equal as much as $327 million per year. 69% of those using the emergency department came from Clark County, 23% came from Washoe County, and 8% from the rural areas. It's important to share with you all that an emergency department is not set up for dental treatment. Those folks go into the emergency department, they get antibiotics, they get pain medication, and they get recommendations to go see a dentist. So we really are not solving the problem, and it's at a much higher cost than what it should be. My program will serve a child in the school setting for $143 per child. There are much more cost-effective ways to provide oral health care in our state and to do better and have better health outcomes for Nevadans. I thank you so much for your time today, and I appreciate your consideration for SB 268. Thank you.
Thank you, Chair, members of the committee. It's always a pleasure to appear before this august committee. Warren Hardy, for the record, representing Future Smiles, that Terry did a wonderful job of describing. And I want to thank Senator Flores. We reached out to Senator Flores because he gave a wonderful speech a year and a half or so ago, to the dental folks about the challenges that he had. I'm really proud of Future Smiles. One of the things we are always looking for in the legislature is the private sector to step up and help and get involved, and philanthropists and donors to get involved, and that's largely what they do. In terms of a section-by-section walk bill, this bill does one thing in Section 1. As Terry said, it aligns the current law regarding billing insurance with the law that was passed in 2001. These services that are provided, we are not looking to expand the services we do. We're not looking to expand these services to non-public health dental hygienists. We're looking to do what we've been doing for 24 years, but have insurance companies acknowledge that those are services that should be reimbursed for. We do have a good number of private insurance companies that do honor these claims. We have others that don't, because traditionally, if it's not, in a regular hygienist, if it's not done under the supervision of the dentist, they will deny the claim. We have the special endorsement and carve-out provided by the legislature in 2001. The challenge is this: a very small percentage of our students have any kind of insurance. And we rely on the dollars from philanthropists and donors to be able to provide those services. But is it 10%, Terry? About 10% of our students have dental insurance of some kind. Some of them Medicaid, some of them have some level of private insurance. The challenge we have is that Medicaid is a provider of last resort. So if we submit a claim to Medicaid for these students and they realize that they are covered under another insurance policy, they will deny the claim. Medicaid will deny the claim. And so what we're trying to do is close that loophole to say, if you are an insured, this is not a new insurance mandate. This isn't requiring anything new of insurance companies. What the bill says is if you already provide insurance and you receive a claim that is for services that are allowed by law, you cannot deny that claim simply because a dentist was not present. I won't go back and revisit the 2001 legislation, but the purpose of that legislation was try to expand services, to try to get services into these schools. The expense of putting a dentist in every situation is cost prohibitive and would remove the ability to provide these services for kids. So that's what this bill does, purely and simply. If you have insurance and you are submitted a claim that is for services that are permitted by law, you can deny it for other reasons, but you cannot deny the claim just simply because there was not a dentist present, because that was permitted by law. Bill does not expand services, does not expand what we're able to do. It's the same thing we've been doing for 25 years. But again, every dollar we have to spend because an insurance company won't cover the claim is a dollar we don't have to spend on a student or a child who has no insurance. And that's the tragedy of the current situation. So again, Madam Chair, I'll be brief, but that's as simple as I can make it. The bill is a very simple bill, should not be confusing or complicated at all, and we're happy to stand for questions.
Thank you so much for the presentation and for the visit in my office yesterday where you were able to answer some questions. I'd also like to say a brief welcome to some of the students that are here over their spring break, and we look forward to public comment and would love to hear from all of them. So thank you so much for being here. We're thrilled to have you in Commerce and Labor, and we hope you stay engaged not just this week but throughout the session. With that, I'd like to open up SB 268 to any questions from the committee. Senator Ellison.
God, I hate to be the first on everything. I think that's a great program. I know that my dentist here in Reno, he was in Elko and he moved back to Reno, but they had a program where they would volunteer thousands of hours to help these children, you know, once they got to the point where they need tractions or fillings or whatever. And I never seen businesses step up to the plate as much as them dentists have and to help these children. Because if they don't do it at an early age, then it's going to come back. And so I appreciate it. But one question I do have, and I ask them when they come to the office when we went over the bill, is if you see a tooth that's decayed and needs a dentist, you refer them to a dentist, but is there a list of dentists that they can get help if they can't afford?
Madam Chair, Senator Ellison, I'm very familiar with your Northern Nevada Dental Health Program. You do have volunteers. Oh, I beg your pardon. Terry Chandler for the record. I am very familiar with the Northern Nevada Dental Health Program, and you do have volunteers here in Northern Nevada. It is different in Southern Nevada. We do not have a volunteer organized program like you do. The other thing that happens with the Clark County School District, anyone that goes into the schools, they have to be fingerprinted, they have to have a background check, and they have to be covered under my professional liability. So if they come under Future Smiles, then I have all those responsibilities. So my staff actually are full-time dental hygienists that work for Future Smiles. I have a part-time dentist and a brick-and-mortar dental clinic at Wynn Elementary, where we provide full comprehensive care. The other back end that we have is the case managers who are bilingual. They call the families, they identify resources. We refer the kids to UNLV, the School of Dental Medicine. We refer the kids to other private doctors. I have several doctors that it's a phone call and I say, hey, it's Terry from Future Smiles. I have a kiddo that needs help. I have doctors that will do pro bono work, whether it's root canals or oral surgery. I have other doctors that we have a negotiation where I pay 50% of their regular fees because they have their overhead too. And I try to work with them collaboratively, and I can utilize some of the unrestricted dollars from the nonprofit. But your Northern Nevada program is very respectable, and I do appreciate what the dentists are doing here in Northern Nevada.
Chair, if I may add to that. So the minute it becomes evident that the services that are required extend beyond what our dental, again, Warren Hardy for the record, thank you, Senator. What I reminded her and then I forgot. I'm nervous because the Attorney General's here and he's always keeping an eye on me and it makes me nervous. So
Mr. Hardy, he did actually make sure you'd be presenting today and then came in right during your bill presentation.
He's been watching me for years, Chair. So the minute we identify that something goes beyond the scope of what we're permitted to do under law, it is referred to a dentist. A dentist is brought in at that point and those services are transferred to a dentist. So we only do the services, our dental hygienists only do the services that are permitted under the 2001 law. We've got great relationships with dentists and help get those services to those kids.
Thank you, Madam Chairman, for letting me do that question.
All right, Vice Chair Daley.
Thank you, Madam Chair. And slight comment, but I do have a question. So support the bill. I think it's a technical dodge. It's a shame that we have to come here and do legislation to get people to do what the right thing is. But so my understanding, and I know you went over all the billing codes and all of that stuff. My wife used to do claims and stuff, so I've heard all of those numbers before and work on our trust fund. So we see some of that stuff. But when you submit that billing code, there's not a different reimbursement rate versus the hygienist that's under the supervision of a dentist and the hygienist that has the special endorsement. It's the same reimbursement rate, right? It's not, I'm assuming it is. It's not more expensive to have the hygienist with the endorsement. So I really kind of see this as a technical dodge by insurance companies, which I guess that's in their nature. They're scorpions, so they're trying to save every dollar and use every little word they can to get out of this. So I support the bill. I'm just curious about it's the same cost.
Terry Chandler for the record. Madam Chair, Senator Daley, that's a great question. So the one thing that I didn't share with you all is that public health dental hygienists get what's called a National Provider Identification Number, which gets into a federal system. They also get a Medicaid provider number. The claims are billed under those individual unique provider numbers. We have several contracts. So we have contracts with Liberty Dental, we have contracts with Fee-for-Service Medicaid, we have contracts with Delta Dental. They all have their own unique contract. Now, what I can tell you is they have a fee schedule, and yes, our contract should be equivalent to that set fee schedule. I do know that they sometimes make special fee schedules for certain providers and the DSOs and things like that. I don't know what their fee schedules are like, but we do sign a contract with them where they say, here's what the reimbursement rate is going to be. But in reality, it won't be any more expensive than what it would be in a private dental office. So yes, you are correct.
Understood. I just wanted to get that little bit of nuance on there, is that it's really just supervised, unsupervised, and insurance providers using that as a shield inappropriately. So it's a shame we have to come here and try to correct that. But we're here and we're going to I hope, get that done.
Chair, I would just add to that, Warren Hardy, I think generally Senator Daley's characterization is correct. We're here because some folks don't do the right thing, but some do. We do have dental assurance programs we work with that pay these claims, don't question them, and are great to work with. So it's not all of them, but perhaps there are some that look for the loophole.
All right. I do not see any other questions on Senate Bill 268, so I thank you so much for the presentation, Senator, Ms. Chandler, and Mr. Hardy. I notice you're moving across the room from the Attorney General. We will invite those who are coming up to testify in support of Senate Bill 268 to come up to the table and testify. Here in Carson City, I don't believe we have anyone to testify on this particular bill in Las Vegas, and then we'll move to the phone lines.
Good morning, Senators, Madam Chair. My name is Karen Soley, for the record. I'm a member of the Board of Directors of Future Smiles, and I also serve as the co-chair for the Nevada Dental Hygienists Association Government Affairs Committee, and today I am speaking on behalf of that association. In 2011, the American Dental Hygienists Association and the Nevada Dental Hygienists Association both adopted policies supporting direct third-party payments to dental hygienists for oral health procedures provided with or without a dentist in all settings. Nevada Revised Statute 631287 allows for the dental hygienist to receive a public health endorsement to their license and to provide oral health care in settings outside of the dental office. Many of those public health endorsed programs are nonprofit. These public health endorsed programs are critical sources of care for many uninsured, underinsured, and Medicaid patients. The ability to receive payment for those services would allow for more care to be given to those who are in need. So we urge you to please adopt SB 268. Thank you.
Good morning, Chair Pezzino, Vice Chair Daley, members of the committee. My name is Wesley Harper. I am the Director of Government Affairs for the City of North Las Vegas. We support this bill. This not only provides better dental health outcomes, but better general health outcomes for our residents. And for that reason, we stand in support. Thank you.
Thank you both so much. All right, seeing no one else coming up to the table in support for Senate Bill 268, we will move to the phone lines. Broadcast, is there anyone on the phones in support of Senate Bill 268?
If you would like to testify in support of SB 268, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify in support at this time.
All right, that will move us into anyone who would like to testify in opposition of Senate Bill 268. Please join us at the tables in any of our physical locations, and then we'll move to the phones.
Thank you, Madam Chair. For the record, my name is Eddie Ableser, A-B-L-E-S-E-R, on behalf of Tri-Strategies, working with the Nevada Dental Association. The Nevada Dental Association is in opposition to the bill. We would love to applaud the work that Ms. Chandler and the folks at Future Smiles does every day. Our dentists work with them, collaborate with them, and value their contribution to the community and to our underrepresented populations that don't get the services. They've identified an issue that's a problem in Nevada. We have significant shortages of providers all across this state. We don't have enough dental hygienists to actually do the work. We don't have enough dentists to actually get out and meet the needs in these hard-to-reach places. Many of our dentists work with the population and work with nonprofits like Future Smiles to reach these needs. There just simply isn't enough. Our schools for dental hygiene only admit 10 individuals a year into their program. We're just not producing enough dental hygienists. 268, while it's well intended, and Senator Daley mentioned it's technical, it's actually more problematic once you realize the implications of what it does. And we've shared our concerns with the bill sponsor and appreciate his willingness to listen to our concerns. We've shared our concerns with Future Smiles and the folks that represent the organization. The way that we are understanding it, first of all, the public health, oral health program within the Department of Public and Behavioral Health, which I had the privilege of actually working with when I worked at the state, does great work. They receive over $2.6 million from the state to deliver to programs like this directly. You don't bill for anything. These are specifically assigned in the program delivery of a public health dental hygienist in schools. And so we have funding available for it. The moment you open up the door for private insurance and claims against insurance, without a dentist or someone who's qualified and trained to diagnose the oral health condition, it creates problems on the validity of the
Mr.
CDT
Ablasar,
code.
we're over 2 minutes. I have a question. So maybe answering this question will help expand your point. I don't know. My understanding is that dental hygienists are literally doing what was put in statute in, maybe it was 2001. I probably wasn't listening as closely as I should have been earlier to the exact year. So if they're literally just doing what's already in statute and reaching out to dentists for any further assistance, this is just to get reimbursed from insurance companies for what's already been put in statute. What am I missing here?
Thank you, Madam Chair. Eddie Ablasar for the record. They are public health endorsed dental hygienists are doing what statute has identified with the public health oral health program, where that $2.6 million that you all assign in budgetary funding goes and flows through a Division of Healthcare Finance policy that funds directly those programs. It is not a diagnosed oral health assessment that a dentist gives to a patient in which a claim is made against the insurance based on that oral health condition or disease. The concern that dentists have is by assigning a diagnosis to an individual without the appropriate person doing that diagnosis could create some medical malpractice of the provider that is giving a consumer a diagnosis without purpose, or perhaps an incomplete evaluation that might be missing significant disease.
Thank you. It sounds like back in 2001, this may have been, and maybe was, an argument that the Dental Association made. Because it's currently in statute, right now I think the bigger question is just the reimbursement from the insurance companies. But I always appreciate seeing you here, and I really appreciate your testimony today. Thank you. Do we have anyone else who'd like to testify in opposition of Senate Bill 268? All right. Seeing no one coming to the table in our physical locations, broadcast, do we have anyone on the phones who'd like to testify in opposition of Senate Bill 268?
If you'd like to testify in opposition of SB 268, please press star 9 now to take your place in the queue.
Good morning, Chair Pazina and members of the Commerce and Labor Committee. My name is Dr. Amy Abatian. I'm a general dentist and I work in both private practice and for the Nevada Army National Guard. And I've been a licensed dentist here in Reno, Nevada for 9 years. I think I can bring a little bit more clarity to some of the comments from Mr. Ablasar, but I would like to speak in opposition to SB 268 today. I am the Vice President of the Nevada Dental Association, and today I address this committee on behalf of our members. There's a lot of complexities surrounding 268. Submission of dental claims to insurances utilizing CDT, or Commission on Dental Terminology codes, requires a formal dental diagnosis, which must be made during an examination with a dentist. So submitting to insurances requires a formal diagnosis attached to that code. During a dental examination, a dentist incorporates all of the relevant information for that patient, a detailed medical history, x-rays, periodontal measurements, and observations of present conditions in order to arrive at appropriate diagnoses and formulate a treatment plan tailored to that patient. Dental hygienists are not statutorily able to provide that diagnosis on their own. That diagnosis, by statute, has to come from a dentist. So dental insurance claims made without an accompanying dental diagnosis attached are not valid. So SB 268 seeks to allow public health dental hygienists to bill commercial insurances without that oral health examination, a dental diagnosis, nor a treatment plan, but without that statutory ability for a dental hygienist to make a formal diagnosis, that claim is not going to be valid. So we as an organization are concerned that improper diagnoses could pose a threat to public health. That's why we maintain high diagnostic standards across all of the health fields, not just dentistry. Protection of patients and delivery of safe care is paramount to us. We wish to ensure standardization and
Thank you
accuracy
so
in
much.
dental diagnosis.
That's 2 minutes. So if you'd like to finish out your comments, and please do provide your full record of comments to our committee secretary so that we can add them to the record.
Much appreciated. Thank you for your time, Chair Pazina and committee members.
Thank you so much. And I'm guessing they can probably add to maybe answer some of these questions in the closing statement. My understanding was that they weren't making diagnoses. They were just doing the job of a dental hygienist, and anything else would be referred to the dentist. But we will definitely get an answer to that, and I appreciate the comments very much. And then we will ask broadcast for any additional callers on SB 268 in opposition. Thank you.
Good morning, Madam Chair and members of committee. For the record, my name is Mariana Kashira, MarianaKacyra, the Executive Director of NDA. The Nevada Dental Association strongly opposes SB 268 as it fundamentally overlooks a critical aspect of patient care and the dental profession structure. Dental hygienists are not trained or licensed to diagnose the conditions, which directly impacts their ability to bill insurance for services requiring a diagnosis. Allowing them to practice independently without the ability to diagnose could lead to gaps in patient care, mismanagement of oral health conditions, and increased risks for patients. Maintaining the current structure ensures that patients receive proper diagnosis and treatment plans from licensed dentists, protecting the standard of care in Nevada. Thank you and have a wonderful day.
Chair, you have no more callers wishing to testify at this time.
All right. Thank you so much. We will move to testimony in neutral on Senate Bill 268 and welcome those to the table in our physical location and then move to the phones.
Thank you, Madam Chair. My name is Helen Foley, and today I'm representing Delta Dental, which is one of the largest dental insurers in the country. We have a contract with Future Smiles. We do provide insurance coverage for those few students whose parents are covered by Delta Dental. As you heard, there's only 10%. The vast majority are Medicaid, but there is 10% of students who do have coverage. I believe that most of those services fall under Future Smiles and their dentists that Delta Dental provides services for. We have not in the past contracted directly with the dental hygienist. So this certainly would be new to us, not that it would be totally opposed, but we do provide those services and pay for them. So we look forward to working with all of those involved and see how this might work out. Thank you.
Thank you, Madam Chair, members of the committee. Adam Plain, P-L-A-I-N, with the Nevada Division of Insurance, who is neutral on this bill. To steal a phrase from Senator Daley, I'm going to technical dodge a portion of this. Whenever we get into scope of practice, standard of care issues, the Division of Insurance doesn't generally weigh in. We have no doctors on staff. We have no dentists on staff. We are not qualified to make comments on those areas. So I will limit this just to, we evaluated this under federal defrayal provisions, expanding the list of providers able to submit billing for a particular service would not trigger federal defrayal positions or ramifications, and that's where I'll leave it from there. Thank you.
All right. Thank you so much. Not seeing anyone else at our physical locations to testify in neutral. Broadcast, we're going to go right back to you to the phones to see if anyone would like to testify in neutral on Senate Bill 268.
If you would like to testify neutral on SB 268, please press star 9 now to take your place in the queue. Chair, you have no callers wishing to testify neutral at this time.
All right, we will invite our presenters, Senator Flores, Ms. Chandler, and Mr. Hardy, back to the table to make any closing statements on Senate Bill 268.
Thank you, Madam Chair, and again, esteemed colleagues of the Commerce and Labor Committee. Again, Senator Flores for the record. Three things. First of all, I want to make it abundantly clear that obviously we are not here to relitigate the 2001 legislation. However, just for the sake of clarity, transparency, we will ensure that we create a working group, and we'll make sure that we invite legal counsel from LCB to join us, so that we make abundantly clear that it is not the intent of this legislation to in any way expand what we've already been doing since 2001. Second, I do want to invite all the members of the committee to engage with Ms. Chandler, see the amazing work that's been done, what they've been doing over the years, particularly those of you who have an opportunity to travel back and forth, that you've come and see it firsthand, the work that we're doing. And then lastly, I also want to just thank the opposition, because I appreciate them coming up. They did reach out to us preemptively and notified us that they did have some concerns, and we're open to the continued work together. I do not take their testimony as them having blindsided us. We had these conversations previously walking into this meeting, so I do appreciate them just being, their candor and kind of walking in on this. But I do believe that there is a misunderstanding about that, and I'd like to hand it over to Mr. Hardy to just kind of walk through some of those technical issues that were raised. Thank you, Madam Chair.
Thank you, Chair, Senator Flores, Warren Hardy, committee members. So I would just say it is true that this is a public health program, as was indicated. I don't know, and I'm not an attorney, I just play one on TV, but I'm unaware of any law that prohibits the private sector insurance companies from participating in paying for services in a public health program. It's really what we're talking about here, is the ability for us to collect dollars for the services we have rendered and have rendered legally by statute. Look forward to the opportunity to work with the opposition. Senator Flores is correct. They did reach out to us in advance, and we're more than happy to work with them. I would agree with the Chair that the opposition testimony appears at some level to be relitigating the 2001 bill. I'm sure if we go back and look at the testimony, it was exactly these kinds of concerns that were brought up. I don't think we're touching on any of those issues. I think the Chair characterized it perfectly. We're looking to get paid for services that we legally provide under the statute, so that the taxpayers don't have to, and so that our philanthropists and donors don't have to. That's the crux of this. If these services are not provided, are paid for by the private insurance companies, that's who's going to pick up the tab. The public through Medicaid or Future Smiles and their donors. And that's what we're wanting to avoid. I never believe I know everything, all evidence to the contrary, Senator Daley. I don't think I know everything. So I'm really looking forward to continuing the conversation with the opponents to see if we can address their concerns, because I always want to do that. The other thing I would say is I'm unaware, and Ms. Chandler told me she's unaware of any claims against, what's the word for, I'm sorry, any claims against a dentist for malpractice. Thank you. I'm unaware of any claims for malpractice. And so those are the comments. The last thing I would say, and I forgot to mention this in the testimony, there is a fiscal note on the bill that we've talked to the division about. We've been informed that they intend to remove that fiscal note, since Medicaid already provides these services, and it doesn't change that impact. So, and if it pleases the Chair, if Ms. Chandler has anything to add, my meandering comments.
Madam Chair, Madam Chair and committee members, I am Terry Chandler for the record. I would like you to all understand that when we go into a school, every child at that school receives oral health education and a dental hygiene kit. Every child gets a consent packet In that consent packet, we ask the parents for their consent to treat, their insurance information, their contact information if we need to contact the parent for the case management as we refer them to a dental provider, and additional services beyond those CDT codes that I read to you that are lawful under the public health dental hygiene endorsement. So these parents who are working parents that may have culinary insurance, which is Nevada Dental Benefits, sign that information for us, expecting us to process claims under that insurance plan. The main one that we see is the Culinary's Nevada Dental Benefits. They're the main private insurance that has this clause where they only cover services provided by direct supervision by a dentist. That's where this keeps coming up. And oftentimes they're low-wage earners and their children are also enrolled in Medicaid. They have two coverages, but the Medicaid side will not reimburse because they want the private side to reimburse first. They are the payer of last resort. And then to speak to Mr. Abeles and the grant money coming from the state of Nevada, when that grant opportunity first came forward 2 years ago, they wanted new schools and new programs to be providing services. I already had a 15-year existent program that was serving 50 schools, so I really couldn't see the bandwidth to be able to expand scope. We currently are one of those grant recipients under DHHS and the School Sealant Program grant to provide services to 10 or more new schools. So the grant's covering those 10 new schools, but the grant isn't doing anything for my 50 schools that I've already been providing services at. It's wonderful that we have it. It's wonderful that we're able to expand, but as we keep expanding, it just becomes more and more apparent that there is this additional private insurance situation that we're trying to resolve with the Culinary Union and work out that directly with them. We've been asking for conversations with them because I don't think they realize. I really don't think that they realize. And again, this is about working families taking off from work and wanting to take advantage of the school programs. Again, I thank you so much for your time today and for your consideration for SB 268. Thank you.
Okay, thank you so much. With that, we will close the bill hearing on Senate Bill 268, and we will open the bill hearing on Senate Bill 285 with Senator Daley and any co-presenters he may have. And after that comes public comment, where I hope we get to hear from a number of the students that are here today. We're so thrilled again to have all of you over your spring break. Thank you.
Thank you, Madam Chair, members of the committee. My name is Skip Daly, representing Senate District 13, here to present Senate Bill 285. And unlike Mr. Hardy, who was up here a minute ago, I'm unaware if the Attorney General has been monitoring me. I don't believe there's any reason for it, so he's not here for me, I don't think. Anyway, SB 285. So I'd like to start with just a little bit of background. Some of this stuff on apprenticeship, unless you're in that arena, it's hard to know and understand. So when I was putting the bill forward, tried to explain to LCB what I was looking for, they drafted the bill in the fashion that I had talked to them about. And then their language was very helpful to me when I saw it and started reading, talking with some of the stakeholders and various things. They said, this is where we need to get to. So I'm going to work off of the amendment. Everybody should have it on that. So a little bit of background. Several years ago, within the last, I think, 3 or 4 years, I was still working at the union for the laborers. When the first couple of one came out, we had some contractors or some employers that wanted to come in and put in apprenticeship standards for a new construction trade. They were calling them solar workers. There were 2 different programs that came in. And within that, they had in one set of standards under one program, calling them solar workers, they had 3 different disciplines. They had electricians, laborers, and operating engineers. And those people could switch back and forth between those trades before those craft types. And all 3 of the crafts that were involved, because we have to get notice, opposed that coming forward in that fashion. None of the employers that put in those standards got as far as a hearing. They withdrew before that. But I know there were two different solar companies. I tried one, and then there was one for geothermal that was trying to combine plumbers, laborers, and I think operating engineers on that one as well. So the fire is out right now, but is still in the background smoldering and various things. And people were trying to put these programs forward and various things because there was tax incentives if you had an apprenticeship program, for instance, for solar projects and various things. So what we're trying to do here, and what I think we've hit the balance on with the help of LCB's original drafting, is now I know where it kind of goes. We're trying to give direction to the State Apprenticeship Council when they get an application for someone to put in a program on what they need to do if the program is trying to create a new building trade, right? Or trying to combine the separate building trades within one set of standards. So there are several programs out there existing with some of the building trades crafts and various other things. So you can have one program and you can teach for different disciplines in the building trades, but you have to have a separate set of standards for each one. So in other words, when you graduate from the program under standards for electricians, you're going to get a certificate that says you're a journeyman electrician at the end. Or a journeyman operating engineer, or laborer, or painter, whichever ones that it may be. You're not going to get a certificate at the end with 3 different crafts that you may have had training in that says you're a journeyman solar worker that you really can't use anywhere else. So when we came up with the change that we're doing in subsection 23, so if the program provides training in more than one construction trade, and as you see, there's 23 things that you have to meet the criteria when you put in your application for standards that the Apprenticeship Council reviews. So if the program is for more than one construction trade, as defined in this section according to the amendment, it must have separate standards for each trade. And then for the purpose of that, where we need to define the construction trades, for the purposes of this section, construction trades means the 15 nationally recognized building and construction trades. These are the 15 nationally recognized. They've been the 15 nationally recognized building and construction trades for 100 years. There hasn't been any new ones added. No one has gone away. They're all there. In the language there, it doesn't say including without limitation. It doesn't say the word including. It says these are the 15 trades. So it's very specific, exhaustive. You can't come in with something else and say, I have a new construction trade. So I hope we're giving pretty clear direction to the State Apprenticeship Council if this comes up on what it is we're asking them to do, is that if a program comes in and wants to cover more than one trade, you have to have a separate set of standards. So when that person graduates, he's a journeyman in one of these 15 crafts. And then the next section there are some standards before we had this where people have more than one craft already recognized under a set of standards. So we're not trying to go back and unwrite those. I didn't want there to be confusion. So if you have that type of program, you can continue under that. But in the future, you would not be able to. So we are eliminating the word interim credential, which when I looked at it, I said, we don't really need to talk to that. We are eliminating the term career lattice because it means different things in different areas. For instance, on carpentry, right, they have several different disciplines within their silo of carpenters, right? They have drywall, they do cabinets, they do Class A formwork, they have drywall, insulation, several different areas. So a person can go through their program and get training and go through and graduate as a journeyman carpenter, but really have only studied or had experience on the job in drywall. But they're still journeyman carpenters for drywall. But it wouldn't stop them under this bill from using that program to go and do cabinetry or Class A formwork, whichever it might be, to receive that training, or have it be part of their apprenticeship in multiple areas within the one major discipline. So that's the bill. Happy to answer any questions. I know it's kind of a esoteric area if you're not familiar with it, and there's a lot of terms that people may not understand. I wanted to not have confusion by using the terms interim credential, which is why I took it out, or career lattice, because they are actually, the career lattice is used within the 15 building trades. But so I think we hit on something that I think it will have support coming up today, an unusual day. You know, Senator Hardy, I'm told, is going to come up in support, you know, which is all good. So we're in alignment on 2 bills today, which is good. Any questions, Madam Chair?
All right. Thank you so much, Senator. Do we have any questions from the committee? And hopefully you've all had a chance to check out the amendment on Nellis. All right. I think we've been quieted. We'll go ahead and have you step back from the table. Thank you so much, Senator Daly. And we will bring up those in support of Senate Bill 285. Please join us here at the table. And we'll get started when you're ready.
Good morning. I'm Craig Madole. It's Madole, with the Nevada Chapter Associated General Contractors. We want to thank the senator for working with us on the amendment. With the amendment, we're in support, and we do believe it adds clarity and keeps the integrity of the apprenticeship programs.
Good morning, Brian Reeder speaking on behalf of the Nevada Contractors Association. That's the commercial construction industry in Southern Nevada. I'll be honest, when Senator Daly asked me about career lattice and told me he was bringing a bill on that, I had to go to Google immediately and find out what career lattice was. And it wasn't just me, it was our association too. They had no idea what that was. But we've talked about it, and with the amendment, NCA is in support. Thanks.
Mr. Reeder, you're not alone. My day job is with an IBEW electrical contractor, and I also had to look it up. Mr. Hardy.
Thank you, Chair Warren Hardy, representing the Associated Builders and Contractors. I thought he said lettuce, because everything goes back to food for me, but apparently there's something. Associated Builders and Contractors in Nevada is in support of the bill as amended. We appreciate Senator Daly for bringing this bill, and he's always been a champion of protecting the integrity and the reputation of apprenticeship programs, and we think this is a good piece of legislation. Thank you.
All right. Seeing no one else here in Carson City, we are going to move to the phones. Broadcast, do we have anyone in support of Senate Bill 285 on the phones?
If you would like to testify in support of SB 285, please press star 9 now to take your place in the queue.
Good morning, committee. This is Wendy Colborn for the record on behalf of the Building and Construction Trades Council of Northern Nevada. That's COLBORNE. And we are in support of this bill and thank Senator Daly for bringing it forward. Thank you.
Chair, you have no more callers wishing to testify at this time.
Okay, thank you so much, AVH team. With that, we will close testimony in support of Senate Bill 285 and open testimony in opposition. Please join us here at the tables in our physical locations. And seeing no one willing to do so, let's head back to the phones broadcast, Senate Bill 285 opposition.
Your public line is open and working, but you have no callers at this time.
And that brings us to neutral. Is there anyone in neutral on Senate Bill 285 who'd like to come to the tables here in Carson City or down south in Las Vegas? All right, get started when you're ready, and thank you.
Good morning, Chair Pazina. Brett Harris, Nevada Labor Commissioner for the record. I'm here with the State Apprenticeship Director, Tony Giddens. The Nevada State Apprenticeship Council falls under our jurisdiction. We had some clarifying questions regarding how this was gonna be implemented, potentially for the Apprenticeship Utilization Act, actually, but I think with the amendment that we just saw, we better understand what the senator is intending with requiring standards for those bigger trades. I do want the State Apprenticeship Director to just briefly explain from our perspective how occupations are looked at under the Department of Labor, because that is actually how the programs get registered.
Good morning, Tony Giddens, State Apprenticeship Director for the record. Thank you for your time. My only concern is just to make sure that we have this clarified as far as registering occupations under the Department of Labor and Rapids as a state apprenticeship agency. We use those terms. And so a lot of in the amendment, the trades that are listed, there are actually several separate occupations under each one of those trades. And so we just want to make sure that we're clarifying that that is already being done, and that whether or not we're talking with new programs going forward, that each individual occupation would have to have a complete set of standards, or if we're able to continue in the way that we are operating, where there is a set of standards with a separate Appendix A, which is the occupational trade training piece of that, and make sure that we're maintaining that going forward. Thank you.
Okay, thank you both so much. And with that, we are going to move to the phone lines for anyone in neutral on Senate Bill 285 broadcast.
Chair, your public line is open and working, but you have no callers at this time.
Thank you so much. We will invite Senator Daly back, and maybe he can respond to the questions from the Labor Commissioner and Apprenticeship Director and close out the bill. Thank you.
Thank you, Madam Chair, members of the committee. Again, Skip Daly, representing Senate District 13, and I believe I can shed some light on those two questions. And if we need to follow up, and there's some language on that. So I don't believe it will affect the Apprentice Utilization Act at all. We already have the apprenticeship programs that are in place, registered by the state, that can send out apprentices. I know there's a document the Labor Commissioner has put out on trying to fill in some of the gaps, and they say, well, my specific thing isn't covered, but one of those 15 building trades, right, covers that area of work, and they direct them to that. For instance, under the laborers, construction craft labor, people understand laborers, and they say, well, where do I go to get flaggers? You go to the laborers to get flaggers, because that's covered under their area. Same thing for brick rod carriers, plaster rod carriers, and those things within that silo, as I talked about. Same thing with carpenters, plumbers, pipe fitters, et cetera. And as far as the occupational code that DOL has, I know they have a whole bunch of different numbers or things that they would recognize in theory. But no, I don't think the State Apprenticeship Council will have to act any differently than they are now. As I gave the example with the carpenters, all of those sub-crafts or sub-classifications that may be recognized for apprenticeship are going to be under the carpenter standards. But if you want to have carpenters and electricians, separate standards. And I think the industry and everybody recognizes that distinction there on that. So within the electricians, they have low voltage, they have signs, they have just general wiremen, they have separate categories as well. When you see painters and allied trades in there, the painters, they do drywall finishing, painting, glazing, floor covering are all within that allied trades piece. They could have one set of standards for all of those if they chose, but they couldn't have painters and then also do heat and frost insulation, right? I think it's pretty well known within the industry and how that's going to work. So I don't anticipate that there's going to be any change. I hope that answers the question for the apprenticeship director. If they have some, feel free to get a hold of me, and we'll get that squared away.
Okay, thank you. And with that, we will close the hearing on Senate Bill 285. And if there are any questions from the Apprenticeship Director or Labor Commissioner, please share with Senator Daly and myself so we can get anything answered as we move forward toward deadlines. And with that, I'm very excited to open public comment. Members of the public may provide public comment in person, by phone, or submit written public comment to the committee's email. Instructions for providing public comment may be found on the agenda, including the call-in information. We are very much looking forward to your comments here today. We do ask that you keep them to about 2 minutes or so. Clearly state and spell your name for the record, and we will begin with public comment from those in our physical locations. Here in Carson City, we're going to get started, and we're so happy to see so many of you over your spring break. Although, Attorney General, I don't believe it's your spring break.
Yeah, I don't think I get breaks these days. Aaron Ford for the record. Good morning, Madam Chair, members of the committee. I'm, as I said, Aaron Ford, your Attorney General. Pardon me, delighted to be here and to be accompanied by several students from Southern Nevada. At the outset, let me say, Senator, thank you so much for indulging us. Senate Bill 63 was supposed to be on the agenda today. We've asked that it be removed so that we can continue working together to facilitate something to better protect youth online. And the Youth Online Safety Act is something that's a very important bill for us and a very important bill for a lot of the students. And several of those students, to my delight and frankly to my surprise, had actually come up to testify in support of Senate Bill 63. They are with me now. We have 4 of them here, and I would ask that you indulge them with the opportunity to present in public comment the reasons why they believe youth online safety is an important issue. They are from, several are from the Equipo School on the east side of Las Vegas, and one, I believe, is from Las Vegas High School. And so with that, I'm going to remove myself from the table and afford them an opportunity to testify. Thank you so much.
Good morning, Chair Pazina and members of the committee. My name is Brian Godoy, B-R-Y-A-N-G-O-D-O-Y. I am a 10th grader from East Las Vegas. Today, my peers and I want to speak with you about the impact of social media on our community. Unfortunately, we now live in a world where social media is no longer just a platform for communication and meeting new people. It has become a tool that lets people attack and bring others down, a tool that lets middle schoolers get their hands on wax cartridges, weed, and other substances, a tool that lets students my age get their hands on guns easily. Many teens my age have lost their lives due to conflicts that originated on social media. All you have to do is look at the news the last 2 years to see what I'm talking about. As someone who knew some of these people and had the chance to see their potential, it is very sad to see how a little dumb post on social media can lead to a crime and or death. Social media should be a space where individuals feel safe, sharing their personal experiences and making connections with one another. Instead, it is a source for violence and hatred. If there was something you could do that would make your own children and teens safer, I know you would do it. Our community doesn't feel safe right now. We are just asking for you to help us support SB 63 to put a limit to things posted on social media, and to get all these bad influences out of East Las Vegas and out of Nevada so teenagers like us can show our full potential and succeed in our community. Thank you.
Good morning, Chair Pazina and members of the committee. My name is Eduardo Guillen, E-D-U-A-R-D-O-G-U-I-L-E-N. I'm a student at Equipo Academy on the east side of Las Vegas. I like to discuss how social media is contributing to the drug crisis in our community. Social media can be a powerful tool for making connections and creating memories. However, it's also unfortunately promotes drugs use. This has had a devastating impact on my friends I go to school with and the wider community in East Las Vegas. Social media apps make it easier for people my age to find and buy drugs without adults even knowing. I've personally witnessed sellers using social media platforms to advertise their drugs, including posts about their prices and the availability of the substances. They make pages on the apps we all use, like Instagram, and then create links to Telegram so you can pay them and get pickup or delivery of dispos and whatever else you want. This access encourages drug use among the youth in East Las Vegas. Unfortunately, social media companies seem unwilling to take action against these drug sellers. They prioritize their own interests and profits over the well-being of their users. They allow anything to happen on their sites because they want our attention and our time no matter what the cost. This lack of responsibility allows drug abuse to continue unchecked, causing harm to families and communities across Las Vegas. This is not right for everyone, as it affects people like the people I know and schools like my own school. This should have never been a problem in the first place. So a clear solution is to go get at the source of the problem and make social media accountable to us. I hope you will support SB 63 and write a law to better protect my friends in our state. Thank you for your time and hearing me out, and have a good rest of your day.
Good morning, Chair Pazina and members of the committee. My name is Kevin Argueta, K-E-V-I-N-A-R-G-U-E-T-A. I am here representing Equipo Academy, and I am an 8th grader. Today I am here to talk about how social media causes violence and depression to people. If you were to just log into Instagram right now, you will see a 5 page for mostly every school in Nevada. If you search up EA or Equipo on Instagram, you will see a fight page for our school. This causes more people to fight just for it to be cool, to post it and to get clout off it or likes. A lot of violence happens because of social media. The reason why it would cause them depression is because after someone loses a fight and it goes on social media, then lots of people see it. Then they will clown the person that lost the fight, and it will cause them depression and won't like to show up the next day to school. Or they will get threaten the people who won the fight and get more people involved. Violence gets worse by people getting more mad by after seeing them getting posted, and they get more mad and they want to get back at them and do worse things like buy a gun. It's easy to get one on social media. I know multiple people that have gotten targeted and even got shot and killed or locked up, all because of them winning a fight and other persons getting mad, or because of buying a gun and not being safe with them and making bad decisions. I think the problem in East Las Vegas is the teenagers causing problems like shootings with guns they shouldn't have. But I think sellers take advantage online to sell them because they don't get caught, and they also don't have a limit. There also should be a limit to all of this. People should use social media for good things, not to affect people like this. I think you guys can help us by making rules for apps that people use to sell things on, and I also think it will help a lot of people if you guys can report or do something about it. All the school pages that people have, and find out who owns them. Thank you for hearing me out. Have a good day.
Good morning, Ms. Chairs Pazina. I'm a member and members of the committee. My name is Diana Argueta, DIANAARGUETA. I am here representing Equipo Academy as a sophomore. Today I'm here to talk about how social media has affected people's mental health. Social media is a part of everybody's daily life and can affect people in good and bad manners, but people use it now to bully and harass people in different ways. It starts as soon as you post something, and anybody can post anything about anybody without there being a limit. There is always rude comments, embarrassing posts of people, and harassing messages. This could really bring people down when they're just getting bullied into not wanting to get out the house or not having any motivation to do anything because they get told something on everything they do or just the way they are. This harassment is hurting schools and other places because students who are getting targeted have no motivation of going anywhere when they know they're going to get made fun of for everything they do. I hope SB 63 and your work could block things from getting posted and make companies process reports faster. Thank you.
Thank you so much to each of the students that have spoken. And I'd like to also make sure that we have written copies of those comments that are sent to the secretary as well, because we do want to get those on the record. And then when we do have the hearing on Senate Bill 63, they can be written support for that bill. So we thank you so much. And before you speak, I'm going to hand it over to Senator Flores really quickly.
Thank you, Madam Chair. Well, first of all, I just want to acknowledge our Attorney General. I know that more than ever this session, you've made it a point to bridge the community, particularly our young folk. I know you're working on several bills to ensure that they have access, prevent future issues that we've been dealing with in the community. Yourself, along with your amazing staff, have been really in the community, meeting people where they stand. And I've also had the privilege of having our Attorney General in multiple occasions work with the community directly in different languages. So I'm just incredibly proud of the work that you and your amazing team are doing. But more importantly than that, I wanted to acknowledge Equipo Academy. They're in my district, and I just wanted to say how proud I am of you. I know it's your spring break, and you could be home, you could be hanging out, you could be playing some video games and doing and that's all good. But instead, you devoted your time to being here. It's just, for me personally, I'm very proud of the work that you're doing. And maybe one day you'll be on this side. We always are trying to build a bench. And I'm just very proud. Equipo Academy, particularly, childhood friends of mine teach there now. And so it's just empowering to see the students come in here and to know that maybe one day you'll be on this side of it creating policy. So super proud of you. Appreciate you being here today. Thank you.
All right. Please proceed when you're ready.
Good morning, Chair Bazina and members of the committee, and thank you, Senator Flores, as our representative. Our students speak better about this issue, and it's so personal to them, so I don't want to repeat anything that they said to you, but I just want to provide the context as one of the teachers who helped get them up here. We were notified by a friend that you all might be discussing this bill, yesterday morning, I messaged the students, and they responded within an hour of this group that they would go. This was yesterday. They hopped on a plane. We had to go to Phoenix. We got to Reno late last night, and they were sitting in the breakfast nook writing the things that they just said to you, because this is personal. I can speak from a teacher's perspective and say all of the colleagues I have who I've spoken to are in support of what the Attorney General's office has already written into this bill, and hoping that in drafting it, you all will go even further to address the teenage issues that they're raising to you. I teach too many 16-year-old alcoholics, and I have too many arguments with 10 and 11-year-olds about dispos and vapes that they think are going to solve all the problems and the trauma that they deal with in their life. And when I ask them to explain it to me or show me where it comes from, it is remarkable and terrifying how easily they can open up an app and show me the page they can get it from, and show me the payment platform that's linked to it, and tell me about the guy who will show up at their house later that day or meet them at the school after school. And that, on top of the bullying and the harassment and the difficulty of getting things taken down, and on top of the violence and the students that we have lost, or the student that was locked up a month ago following things that happened on social media from our school, from our former students. I don't want to keep doing that, and I'm excited that the Attorney General's office is helping us do something about it, and I will be back for your hearing. We support your work on this.
Thank you so much, and I just want to get your name for the record, if you can state and spell your name.
My name is Ben Salko, BenSalkowe. I was the founding principal for 9 years for Equipo Academy, and I'm currently working with students to help them become advocates for East Las Vegas.
Thank you so much. Well, it's such a pleasure having you here, and it makes my heart so happy hearing the articulate words of the students of the Academy, and we thank you so much for being here today. Again, please share your written comments with our secretary so we can assure that they're on the record when it comes time for the hearing as well. And we thank you so much for being here, and know that one day you'll be sitting behind this dais. The future is very bright, so thank you so much. With that, I did want to share with everyone, there is an opportunity potentially that we will be having a committee meeting tomorrow with deadlines coming up. That committee meeting would start at either 8:15 or 8:30 tomorrow morning. I will share more as we get confirmation that we will indeed be having committee tomorrow. So we may just be seeing you back here a little sooner than planned in order to get some of these bills heard before our next deadline. But we thank you so much for being here today. And with that, this committee meeting is adjourned.